When we talk about dementia, we often focus on the person who's been diagnosed. But caregivers also experience tremendous changes in their lives as a result of this diagnosis. In fact, studies have shown that people who care for those who have dementia are at risk of developing depression and illness themselves. A 2009 study by the National Alliance for Caregiving and the AARP found that caregivers' immune systems are compromised for up to 3 years after their caregiving experience ends, thus increasing their chances of developing a chronic illness themselves. Furthermore, a study by the Alzheimer's Association found that about 40% of family caregivers suffer from depression, as compared to between 5 and 17% of non-caregivers. That study also states that rates of depression increase with the severity of the dementia. So here's some tips for keeping you, the caregiver, healthy and well. Make sure you have a support system of people who can fill in for you. Whether it's an adult child, a sibling, or a professional, it's important to be able to step away and refresh yourself every once in a while because you have a life too. And don't be afraid to pamper yourself. Whether you take a walk or buy yourself something you've always wanted, treat yourself. You're worth it. So here's some tips for caregivers. Once a day, take a time out. Determine your level of need for breaks and tailor it to the level of care needed by the person with dementia. Now here's a way to tell if you need some time out. If you find yourself irritated or short or getting in arguments, it's an emotional indicator that it's time to take a break. So recognize and address the physical indicators of exhaustion, fatigue that you can't get rid of, changes in your body such as headaches and colds, or new habits that might crop up like eating in excess or drinking more alcohol. Get the care you need. Consider seeing a grief counselor. Here are some more tips. Be very rigorous in your self-care. Make a plan that allows you to get plenty of exercise and to eat properly. It could be a daily checklist or as simple as putting on a health tracker, but make sure that self-care is your priority. Get plenty of sleep. And if your sleep pattern is disturbed by a loved one's dementia, it's an indicator that you need more help. And make an effort to maintain your social relationships. Go play cards, take a class, or see a concert, even if you don't feel like it. Please don't isolate for your own sake, as this is frequently seen in caregivers. Here are some more tips. Join support groups. The Parkinson's Foundation and the Alzheimer's Associations have them because you're not alone. It helps caregivers gain perspective when they are among other people in the same boat, and you might even make some new friends. Keep your stress levels low by setting appropriate expectations. People with dementia don't act this way on purpose, and their behaviors may vary, so take every day as it comes. And have the perspective that this is a long game, not a sprint. Your own health is your greatest gift. So get help if you need it. Support from family and friends might not fall out of the sky, so you need to ask for help or contact a professional service. No one should be asking you to do this alone, and if you feel that you need help, get your help. Our company of professionals at Thoughtful Care, we offer varying levels of that help, from just a few hours a day to 24/7 care. So we're here to support you and your loved one. Nobody said caring for a loved one with dementia is easy. It is a challenge, there's no doubt about that. But rather than looking at the past as a series of exhausting days and at the future as a crisis waiting to happen, take time every day to breathe a little, to get perspective, and stay within that 24-hour day. It's when you take time to refresh yourself and acknowledge your strengths that you can gain the perspective you need. And reach out for help when you need it, and sometimes it's only a phone call away. Thank you.